All right. Good afternoon, everyone. I'm not sure if that was caught, so I'll repeat myself. Good afternoon. Thank you guys for joining us. My name is Jamie Trotter. I am with the National Patient Advocate Foundation, and I'm here to introduce Kate Gallagher, who is our Senior Director of Research with Patient Advocate Foundation, and who's going to be leading us through this webinar to discuss the coronavirus. We are all hunkered down and safe, and we hope that you are too. And thank you for joining us just to get some of the facts. So I will turn it over to Kate.
Great, thanks, Jamie. I'm just trying to get the screen share to pop up here. Hang on. There we go. All right. Thanks for the introduction, Jamie. For those of you who may not be familiar with me, I'm an epidemiologist and health services researcher. I did my undergraduate work in environmental science and engineering in water and sanitation at the University of North Carolina at Chapel Hill. And I did my master's of public health and epidemiology at Emory University in Atlanta. I was also fortunate enough to intern in an influenza laboratory at CDC during the SARS outbreak in 2002. So this is definitely a topic that is near and dear to my heart and something that I've had a little bit of experience working in. I've also spent time working with the New York City Department of Health, the New York State AIDS Institute, the Mount Sinai School of Medicine, and Columbia University. My early research focused on the adaptation of HIV RNA testing to identify acute HIV infection. I've also done some work in the environmental space, looking at environmental impacts of immediate household surroundings on pregnant women and children and their development. And I've also spent some time doing some policy work for the adaptation of technology-driven medical devices in the amputee community. Currently, right now with PAF, I'm the Senior Director of Health Services Research, and most of my work is at the population level doing quantitative research projects. So I know there's been a lot of information that's been out and about coronavirus. I'm sure we've all seen the basic messages to do social distancing, to wash your hands. But many of us may not actually know what human coronaviruses are. There's many of them that are out there. Many cause mild upper respiratory tract infections. Not all do. I'm sure many of you may be familiar with the SARS or the MERS outbreaks that happened in 2002 and 2012. SARS was the severe acute respiratory syndrome, and MERS was the Middle East respiratory syndrome. Neither one of those became pandemics, but they were definitely severe outbreaks in limited regions within the world. So what is COVID-19? So it's a new disease. We know that means it's been caused by a novel or new coronavirus, and that means that's one that has not yet previously been seen in humans. The naming convention, CO stands for corona, VI stands for virus, D stands for disease, and 19 is for the year that it was identified. And this is probably one of the most common acronyms you'll see for this pandemic used in the news and in resource materials. So what are the risk factors and the severity? Many people with COVID-19 can have no symptoms, or they'll develop mild or severe or fatal illness. They've been showing us that children may have less severe disease. Current case fatality rate is about 2%, but that's with those with laboratory confirmed COVID-19. Those numbers could look differently since we know there's a lot of asymptomatic or untested individuals that may not be included in those numerators and denominators. And we know that right now the main risk factors for severe illness include older age and underlying chronic medical conditions. So how does COVID-19 spread? Someone who's actively sick can spread the illness to others. It's primarily person to person. So this means that you actually need to cough, sneeze, touch someone to spread the infection. We know that the virus can live on objects. Specifically, it likes to live on hard surfaces. So if you're ill and you sneeze on your hands and you touch a doorknob or you touch a surface and somebody comes back behind you, opens that door, they can acquire the virus from that object. We know that it takes about 2 to 14 days, although they're thinking if the median onset is 5 for an infected person to show symptoms after exposure. Most people are most infectious while they are symptomatic. However, you can be asymptomatic and transmit the virus to others. And we know that it's a rather effective spreader when people are in closed conditions. So how does COVID-19 spread in a community? A term that epidemiologists like to use is the Arnott. And this is a mathematical term that can indicate how contagious an infectious disease is. It can also be referred to as the reproduction number. So right now, modelers are showing us that they think that the Arnott of COVID-19 is somewhere between 2 and 3, with some modelers giving it a value as high as 3.5. So what does that mean? It means that a single infected person has the potential to infect 2 to 3 additional people, and this starts a chain reaction of infection spread. So if we look at the example, if the red individual is our COVID-19 case, and they come in contact with 2 people, and those 2 people become infected, and then those 2 people come into contact and spread the disease to 2 additional people, you can see how a single person can go on to potentially infect an additional 30 cases. And this is specifically why public health officials are asking individuals to maintain a distance of 6 feet apart, as well as to avoid any large gatherings. So another way to think about how infection can spread is this example here. So we see we've got one sick individual in yellow, and they're oh so carefully getting within that 6-foot space of other individuals. And we can now see that they've set off this chain reaction where the healthy blue circles are slowly becoming yellow infectious circles, and those yellow circles are becoming sick cases of COVID-19. So we've mentioned how this disease gets transmitted from person to person, but what are the signs and symptoms? What should you be looking for? How do you know if you actually have COVID-19 and you don't have something else? Say, this is allergy season. I live in Atlanta. There's a beautiful tree flowering outside my window, and there's a lot of pollen in the air, so we definitely see a lot of people sniffling, sneezing, and coughing. For those with COVID, you're looking for individuals with fever, fatigue, dry cough, difficulty breathing, and aches and pains. So you see COVID has all 5 of those criteria. Whereas if you look at a cold, allergies, or influenza, you can see that some of those categories have been omitted. This is why public health officials are asking people with all 5 symptoms to reach out to their medical providers for screening. So what should you do if you actually think that you're sick? First things first, call or email a healthcare provider. Alternatively, you can do a telehealth screener online. There's a great one at covid.ro.co/together. Based on the recommendation from either the screener or from the healthcare provider, follow their advice on where to go for testing. Do not go to an emergency room. The only reason you would need to go to an emergency room is if you have severe respiratory symptoms and you're in danger. Where can you actually go for testing? We now know that all states have a public health lab set up for testing coronavirus, as well as commercial and academic testing collaborators. Many state health departments on their websites have hotlines, and you can call them for information on where to go for testing or who to contact for screening. And it's important to note that your doctor or medical provider will be the one who will determine if you need in-person testing, and they will direct you to where you'll need to go to receive it. How much will testing cost? Well, many health departments and state labs are providing free COVID-19 testing. However, many of them will require your healthcare provider to provide some sort of written or electronic confirmation that you meet the testing criteria. If you have questions, there's a great online resource that was pulled together by NBC News. They contacted every single health department in the United States, and it lists them out by state or locality, and they have resources that they'll link you to look for free testing. What do you do if you don't have insurance and you feel that you need to get tested for COVID-19? Well, the Families First Coronavirus Response Act gave states the option to expand Medicaid coverage to uninsured individuals in their state to help to provide coverage for COVID-19 diagnostic testing and free of charge, as well as many of the health departments that are providing free testing. All you need to have when you go in is either your ID, and an epidemiologist on site will screen you to see if you are in need of COVID-19 testing, or to have a medical provider's indication that testing is warranted. So each state health department has different resources for providing testing to individuals who are not insured. Two examples that I came across is Alabama has now opened 6 free mobile COVID-19 screening sites across the state, and the Colorado Department of Public Health is offering free screening at their state lab. Again, the best place to go if you're uninsured is to look at your state's health department website for testing information or hotlines. So how much will treatment cost? So most people infected with COVID-19 will not need to be hospitalized and will be able to recover at home. Those who do need to go to the ICU likely can expect big bills regardless of insurance coverage. And Kaiser Family Foundation right now estimates that the average cost is going to be somewhere around $10,000 for uncomplicated cases, and it could be twice as much for complicated ones. That being said, what are the personal out-of-pocket costs? We estimate that patients with employer-based insurance can expect costs of more than $1,300, but that will be dependent on their deductible and out-of-pocket maximums. Medicare and Medicaid will also likely cover the services needed for coronavirus treatment, but out-of-pocket costs will be dependent on the plan or the state you reside in. Costs to watch out for could include additional lab tests, which could be considered out of network, even if the doctor treating you is in your insurance network, depending on where those labs are sent. Will I get a surprise bill? It's possible, especially if you go somewhere that isn't in your health plan's network, or if you undergo an array of unrelated tests to COVID diagnostic testing. Your health plan, though, is generally going to view treatment for COVID-19 like the treatment for any other illness, just as if you developed a bad pneumonia or if you have a chronic condition like diabetes. Some, but not all, insurers have eliminated out-of-pocket doctor costs for consumers when getting tested. And right now, AHIP, and pardon me, right now AHIP, which is an organization that represents health plans, they've compiled a list of insurers that are waiving copays for testing and doctor-related visits. And so I recommend if you have questions about that, go to their website. What should you do if you do get a bill? The first thing that we recommend is that you compare your EOB and bill. Your EOB is your explanation of benefits. Patient Advocate Foundation has several resources that if you have questions about how to explore a health insurance claim on our website, and we've provided 2 links here. The next thing you can also do is to contact your insurer as well as the hospital or doctor to find out if you really owe what they say you owe. In many instances, if you explain that you didn't realize that the care, which in this situation is essential, would involve out-of-network providers, they may be able to work with you to move you to an in-network cost. And also check with your state insurance department to see if your insurer should have charged you in-network rates. There are some states that are working with the insurance departments to get them to move towards that model. So if you test positive, are there resources? So the Families First Coronavirus Response Act has authorized federal emergency paid leave benefits to provide payments to some employees. Small businesses with fewer than 500 employees can have the ability to provide up to 2 weeks worth of sick leave if the employees are unable to work because they're subject to quarantine, experiencing symptoms, or caring for somebody who's in quarantine. And these are changing on a daily basis. So as we continue to learn more information, the team at Patient Advocate Foundation is working to provide a follow-up set of webinars that will have other tips and resources for individuals who are experiencing concerns if they've tested positive for coronavirus or if they're caring for somebody who has been tested positive for coronavirus. And that's the end of this first webinar. Are there any questions?
Kate, this is Caitlin Donovan. I was just wanted to say thank you. This was great. Everyone who's on here, you can type your message in the chat if you don't want to say it out loud, and we'll keep an eye out for it. Otherwise, there's a survey right after this is done. It's just 2 questions, if you could answer it. And this has been recorded, so it will be available on our website afterwards. All right, thank you, everyone.